Good morning, everyone. For this return demonstration, we will do the first part of the health assessment. So first, we must do the vital signs. So we have here Mr. Don Humauas Jr., who will be our patient for in getting the vital signs. So as you can see, vital sign is fundamental tool or is a fundamental pathway in diagnosis, in patient diagnosis for his diseases or for his illnesses. So there are five types of vital signs, or there are five kinds of vital signs. So first, we have the blood pressure, the respiratory rate, the heart rate, the pulse rate, and the fifth vital sign is the pain. So first, we must go to the fifth vital sign, or the last vital sign, which is pain. So I'm going to ask Mr. Don Humauas to, I'm going to ask you if, do you feel any pain right now?
No.
No. So that's good. He doesn't feel any pain right now. So as you can see, our patient is very healthy. And so from 0 to 10, 10 as the really painful score, what is your feeling at this moment?
0.
0. Okay, so the patient is really good, healthy, and good in shape. So and then, um, is there pain now, or are there? I mean, if you have pain, do you what? So maybe we could ask Don if the pain now is like shearing, burning, or grabe ka sakit, or kanang dili kay sakit, or wala sakit.
None so.
None so far. So wala di sakit. Kanang okay to lang ako ang patient. So that is the fifth vital sign. Now first, we must go to the blood pressure. So we are going to use a sphygmomanometer coming from MTI. So we will use that in getting his blood pressure. We will be introducing the systole and the diastole at the next part. So and then we must also need the stethoscope. So it is good also to let you hear, or to let the nurse hear the systole and the diastole of the patient, which is we are going to do it now. So first, so now we are going to do the blood pressure. So we must ask the patient to fold his clothes or his dress, and ask the patient to put his hand on a surface. So since we don't have any surface here, so we just do the back of the chair. And then, if you have a sphygmomanometer, you will see two strings here. So at this point, you must locate the right artery or the left artery. Every time, different. So you must locate the patient's artery. So the patient's artery is right here. You can feel his artery pumping. So at this point, you must put two these two strings on his artery. And then when you put it, the patient's elbow, or the patient's bending part, you must put this sphygmomanometer at the front of his elbow, and it must be 2 inches above from his front of his elbow, or the bending. And then we must put the meter here, or any, so you must put the meter in any part of the body, or in any place where it is visible. But for this one, we must put the meter hanging to his to the cloth of the sphygmomanometer. And then we will use the stethoscope to better hear the systole and the diastole of the patient. Sir, mag-BP na ko niyo, sir, ha? You must put the stethoscope here at the artery to better hear the pumping. So the patient's blood pressure is 100/60. As you can see, when doing the blood pressure thing, you must first hear, you must directly go to the, you must ask the patient if he is having some problems on his blood pressure and sort of like that. But if the patient is normal, you can just go to the minimum will be 160. You must pump air to 160 and then you must release. And then the first beat or the first tick that you can hear, that is the systole, and the last tick is the diastole. So that's why we could get that his blood pressure is normal, and that is 100/60. So the next part or the next vital sign would be the O2 saturation. We need an oximeter for that thing, but since we are on the province, we could not provide an oximeter. So an O2 saturation, if you could see it in the Google or the internet, or I will provide pictures on this video, you will use that in order to get the oxygenation or the measurement of your blood's oxygenation level. So it is just a clip that you will you will put at the fingertips of the patient. You must find the pinkish fingertips of the patient. So as you can see, it will be the index finger of the patient, and then you must clip the auto such or the oximeter, and then you can get the auto saturation of the patient. So in the pulse rate, you must locate his wrist artery or the radial artery, which is located here on his wrist. That is the radial artery, and you must have some stopwatch or a time or a clock so that you could measure its pulse rate. So what you will do, you must count, or you must have 1 to 30 what do you call this, timer, and then you must, for during that 1 to 30 seconds, you must also count the number of his pulse pumping. So we must start this one. Okay. So after 30 seconds, I counted 30. Take that. So after 30 seconds, I counted the patient's pulse rate, which is 36 pulse in 30 seconds. And we must convert it into per minute. So we must do times 2 the 36. So 36 times 2 equals to 72. So the patient is quite normal, having 72 beats per minute. So that is his pulse rate, which is really normal, because the normal range of the pulse rate of an adult person is 60 to 100 beats per minute. So just like the pulse rate, we must also do the respiratory rate in a pulse rate manner. So you must have a stopwatch, and then you must locate his stomach, or maybe if it's visible to you, you could count his breathing in, breathing out, or inhalation and exhalation. So we must also count 30 seconds for that, and we must count his respiration. So let us start now. Sir, kindly breathe normal. Now done 30 seconds. So my count in his respiration or respiratory rate is
6.
Okay yan.
So after 30 seconds, we are now counting his respiration or respiratory rate. So as I count, it is 8 inhalations and exhalations, or 8 respiration. So we must times it to 2, because the measurement should be per minute. So 8 times 2 would be 16. So 16, his respiratory rate is 16 breathing in and breathing out per minute. So as you can see, the patient's respiration is also normal, because the range is 12 to 20 for adults. So the patient belongs to the normal respiration. So the last and the fifth vital sign is your temperature. So if you have a thermal scanner or kanang it's a so the last or the fifth vital sign is the temperature or the patient's body heat and the index. So if you have a thermal scanner or a thermal gun, you must you must put the thermal scanner on his head or any other part of his body which corresponds heat. So maybe in his head, in his oral or in his mouth, or maybe here or sort of like that. So at this moment, we just have a thermometer, which we will put this in his armpits, and we could have this thermometer, his temperature check. So sir, I will put this on your armpits, and then let us do the thermometer. So the beat now is so so we must first listen to the beat so that we could examine his temperature, and the beat has had already beaten. So let us get. And his temperature is 36.9. So it is normal since 37.5 is the maximum or the borderline of the temperature of an adult's body.